The global pandemic COVID-19 is caused by the SARS-CoV-2 virus. A characteristic feature of COVID-19 is its ability to trigger a cytokine storm. A cytokine storm is the acute overproduction and uncontrolled release of pro-inflammatory markers. In most patients, COVID-19 leads to pneumonia, and it leads to acute respiratory distress syndrome or ARDS in around 15% of cases. ARDS is a leading cause of COVID-19 related deaths and is mainly triggered by cytokine storms. Reviewing treatments that target the inflammatory response resulting from cytokine storms is a possible strategy for treating COVID-19. A study published in Virology Journal examined the efficacy of specific inhibitors of interleukin-6, interleukin-1, interleukin-17, and tumor necrosis factor alpha, which suppress inflammatory response. Interleukin-6 is a glycoprotein that can act as both pro-inflammatory and anti-inflammatory. Elevated levels of this cytokine are seen in COVID-19 patients. Interleukin-6 inhibitors reviewed in the study have been shown to reduce inflammatory responses. Interleukin-1 is a cytokine that can accumulate at high levels in the lungs of COVID-19 patients. An antagonist of the interleukin-1 receptor, Anakinra, can have beneficial effects in alleviating the inflammatory storm in severe cases of COVID-19. A monoclonal antibody, Canakinumab, has been shown to considerably improve respiratory dysfunctions and blood parameters. Interleukin-17 is a pro-inflammatory cytokine released by Th17 cells, and it can exacerbate inflammatory reactions. Interleukin-17 blocking agents have high efficacy and tolerability without reducing lymphocyte count. Tumor necrosis factor alpha is associated with bronchial hyper-responsiveness and linked with a reduction in airway caliber. Tumor necrosis factor alpha can directly deteriorate the respiratory epithelium by producing inflammatory cytokines such as GM-CSF and interleukin-8. Blocking the TNF-mediated inflammatory response leads to a rapid decline in the level of interleukin-6 and interleukin-1 in individuals with active inflammation. The management of cytokine storms by their inhibitors can improve the survival of patients. Anagen has been involved in cytokine research since the 1990s and has developed hundreds of hybridomas that produce high specificity and high affinity monoclonal antibodies directed against cytokines including tumor necrosis factor alpha, GM-CSF, interleukin-2, interleukin-8, interleukin-10, interleukin-15, and interleukin-17, as well as interleukin-18. Along with monoclonal antibodies, Anagen has produced ELISA kits for detection of multiple cytokine epitopes. For more information, please visit Anagen's website at www.anagen.ca.